Hello everyone. Today we are going to start the part 10 of our clinical case scenario series. So let's get started. Here we have the MCQ number 46. A 20-year-old soccer player present with the grade 2 right lateral ankle sprain upon evaluation. So what are the characteristics of the grade 2 ankle sprain? Option A. There is a partial tear of the lateral ligament complex with the mild joint instability, moderate intracapsular swelling and tenderness, and some loss of range of motion and joint function. Option B. There is a complete rupture of the anterior talofibril ligament and the capsule with the mechanical joint instability, severe intra-extracapsular swelling, ecchymosis, tenderness, and inability to weight bear. In option C, stretch of the lateral ligament complex with no macroscopic tear or the joint instability or little swelling or tenderness. And in option D, there is a partial tear of the syndesmosis, creating the generalized swelling and tenderness throughout the ankle joint complex, inability to bear the weight, severe ecchymosis, and mortise widening. And the correct answer is option A. In the case of grade 2 right lateral ankle sprain, there is a partial tear of the lateral ligament complex with mild joint instability, moderate intracapsular swelling and tenderness, and some loss of range of motion and joint function. Here we have the explanation. In the case of grade 2 ankle sprain, there is more severe form of sprain, but incomplete tear with moderate pain, swelling, and bruising occurs. Although it feels somewhat stable, but the damaged area are tender to touch and walking is painful. Moving toward another scenario, a physical therapist evaluating a 66-year-old female patient who has a history of severe head trauma following a motor vehicle accident. The patient has difficulty with rapid alternating movement while performing neurological testing. The best term to describe this specific impairment is option A, ataxia, option B, dysmetria, option C, dysarthria, and option D, dysdiadochokinesia. And the correct answer is option D, dysdiadochokinesia. And here we have the explanation. In the case of ataxia, there is a global term that comprising the inaccuracy and decomposition of the movement. Although this encompasses many forms of movement impairments, it is too general to describe difficulty with rapid alternating movement. In case of dysmetria, which is defined as a decreased ability to judge distance and range, and in case of dysarthria, which is defined as a motor impairment involving the muscle used for speech and breathing. On the other hand, in the case of dysdiadochokinesia, is an impairment that specifically involving the rapid alternating movements, such as pronating and supinating one's hand quickly. Moving toward another scenario, a 79-year-old female present to outpatient rehabilitation services 6 weeks following a CVA with right hemiplegia. She complains of right shoulder pain working on functional upper extremity movement and has severe shoulder pain when practicing bad mobility activities such as rolling and squatting. On examination, it is observed that the humeral head is inferiorly displaced. So which of the following would be the most appropriate for her condition? Option A, transcutaneous electrical nerve stimulation. Option B, functional electrical stimulation. Option C, shortwave diathermy. And option D, interferential current stimulation. And the correct answer is option B, functional electrical stimulations. Let's see the explanation. In the case of TENS, which is a powerful modality that will treat pain in many individuals, this woman does complain of pain, but the impairment of the inferiorly displaced humerus head is also mentioned. So the TENS will have little effect on this displacement. Using the functional electrical stimulation to help elevate her shoulder will treat the displacement and ideally eliminate the source of pain as well. And while using the shortwave diathermy is a pain relief modality that is not used for displacement. And in the case of interferential current, that is another form of TENS and will not help much more with the displacement of the humeral head. Moving toward another scenario. A patient present to the inpatient rehabilitation unit who has suffered a vertebrobasilar CVA, or vertebrobasilar cerebrovascular accident, and has difficulty adducting and depressing the eyes. Which cranial nerve is the most likely cause of this impairment? Option A, cranial nerve 1, option B, cranial nerve 2, option C, cranial nerve 3, and the option D, Cranial 4. And the correct answer is option D, cranial 4. Here we have the explanation. Cranial testing for the ocular movement is performed using the H pattern to assess the tracking movements. So difficulty in adducting and depressing the eye is indicative of trochlear nerve involvement. Moving toward the last scenario of today's part. A geriatric patient with walking pneumonia has the history of recent fall is receiving the physical therapy for general strengthening. So which part of the person's treatment be affected most by this lung condition? Option A, decreased stamina and tolerance of the activity. Option B, inability to participate in endurance type activities. Option C, diminished tidal volume. And the option D, lower oxygen saturation with moderate activity. And the correct answer is option A, decreased stamina and tolerance of activity. Here we have the explanation. Having a walking pneumonia and the history of fall indicates a decreased tolerance of activity or the stamina will likely slow down the therapy process mostly. But the patient treatment will focus on easy endurance type activities and the patient will be able to participate some. But the diminished tidal volume will be the part of the issue but can be monitored and controlled with coaching, but will not be the most effective portion because it will be difficult for the patient to perform much moderate intensity activities. That's all for today. Thanks for watching.